So welcome everyone to the Metrics International Forum. The forum is organized by the Meta Research Innovation Center at Stanford, or short Metrics. The center is directed by John Ioannidis and Steve Goodman, and we are a research group and fellowship program dedicated to finding ways to improve the validity and transparency of scientific research. I'm Max Siebert, a postdoc here at Metrics, and I will be today's moderator. All of our international forums are recorded and can be accessed on our website and on YouTube. Please keep your questions till the end, write them in during the presentation. Our presenter today is Noah Haber. His formal background is in global health economics, with particular interest in policy impact evaluation. His recent meta-science work has taken the policy impact evaluation approach and applied it to institutional science itself, including developing methods and systems to review and understand strength of causal inference and evidence, helping decision makers understand the extent and nature of evidentiary uncertainty, executing large-scale collaborative experiments and reviews. Noah is currently a research scientist at the Center for Open Science, where his work focuses on innovations in science on science using collaborative research designs. So if you're ready, Noah, we can start.
Absolutely. Yeah. Thanks for the introduction. It's good to be speaking with everybody today. If there's a clarification type question, feel free to drop it in the chat, and somebody is welcome to anytime during the presentation. Anybody's sort of welcome to interrupt if I don't see it. But I'll try to keep a lot of time open for discussion at the end. Really excited to be talking about this because I think that in a lot of ways, this is the most ambitious and also weirdest project I have ever gotten the opportunity to work on. We're going to be talking about a bunch of things, a very, very strange. It's hard to call it a trial. It's hard to call it it's a meta-analysis. It's really hard to describe what this is because so much of it really has not been done before, which is really exciting and also terrifying. So what I'm going to be talking about is three things. So we're going to be talking about a particular policy that we call registered revisions. Speaking of things that don't exist before, registered revisions is a word we had to make up about a year ago because there was not a word for this particular policy. We're talking about an evidence framework, so this very strange meta-analysis, multi-study idea, and then an experimental design within all of these sort of sub-trials that are built in a very strange kind of semi-centralized way. And what this all represents together is a way of actually moving evidence, moving forward journal policy in a way that is actually developing evidence along the way, and the evidence helps develop the policies, and the policies help develop the evidence, and so on. So the big picture thing here is we can actually do evidence-based journal reform in a way that we've not been able to in the past, hopefully. Backing it up a little bit, do want to talk a little bit about what the kinds of things that we're going to try to deal with in the policy itself. So the normal traditional publication model that everybody knows, where peer review happens at the point of actually after you've collected all your results, you've written everything up and so on, and that decision for accept or reject happens after everything is the end, encourages some things that we probably don't like in research. So there's a lot of pressure for having a preferred result like p less than 0.05 or something like that, right? Or because you want it to pass peer review and get it published, and null results are less desirable by journals. So there's a lot of pressure to get preferred results. There's a lot of waste because the review happens at the worst possible time when it's too late to actually make changes to the protocols and what you're actually doing going forward. So if there was a change, you can't do that. You can't go back in time now. A lot of encouraging for questionable research practices, the usual sorts of stuff. So p-hacking, hypothesizing after results are known or harking, and so on. So this is, these things maybe exist without this traditional publication structure, but they're exacerbated quite a bit. Publication-related biases, and that missed opportunity for feedback, as we described before. So, there are a lot of things about the traditional publication model that might be problematic. And one of the things that has been proposed, or the types of approaches that have been proposed here, are research pre-commitment devices. The general idea is to sort of start from an earlier phase and commit forward a little bit. So that might enhance planning, right? So you actually know what you're going to do ahead of time. It helps you do things like if you think about the whole study of exactly what tests you're going to run and all that stuff from the beginning, you don't end up with this problem at the end of like, oh, we should have designed this differently from the beginning. So pre-commitment devices can help with that. They might mitigate some pressure for questionable research practices and publication biases. It kind of depends a little bit on how strict the commitment device is itself, the nature of it, and a lot of things we don't really know. And it helps put focus on the methods before putting focus on the results, so that the methods drive strength of inference, not the results. The results are just the result of all of that. So two common ones that people are pretty familiar with: pre-registration, so taking your idea, taking your plan before a study is actually enacted, putting it down on paper and saying, okay, this is our plan. We are, for the most part, committing to this going forward. Or registered reports is another emerging one, although, as we'll talk about, every journal we have talked to in this project says, yes, we do registered reports. Nobody's actually submitting registered reports at our journal. So it's in theory popular, but in practice is not. The take-up has been pretty poor all around. But the idea of a registered report is you take that pre-registration and you subject the pre-registration to a form of peer review. And then if it passes peer review after some rounds of modification, then you get an in-principle acceptance, as in, if you enact this study the way that we have agreed you're going to do this, regardless of what the results are, it will be accepted in the end, excepting a couple of unusual circumstances. So it's this idea that you put the review at the earlier phases when it's most effective, and don't worry about too much about what the actual results are. So you kind of reduce pressure for p-hacking and all that stuff. But registered reports are not taken up very much. So we have a slightly different take on that we're calling registered revisions. So registered reports requires that you start at the very beginning, way before, before you've collected data and so on. It's part of why it's hard for people to do, because you have to commit to it so early, and it's a very new thing and so on. It takes some time for people to get used to these kinds of things. So registered revisions is a different take on this idea. So rather than start at the beginning, what we're going to do is we're going to wait until the point at which a peer reviewer has reviewed the results and all of that in the traditional manuscript way. And then if the reviewer or reviewers ask for new analyses, so that might be run this other test, or new data, that could be do some extra experiments, or who knows, collect some additional data, anything that's kind of new, then the policy triggers. And the policy is basically kind of like a miniature registered report. So the author is asked, instead of actually, do the experiment or whatever it is, make a revision plan, right? Tell me what you're going to do to address these comments in an empirical way before you actually collect the data. The reviewers and the editors will review that plan and make an in-principle acceptance decision based on both the revision plan, so that how you deal with the request for new data, and your sort of standard responses to reviewer questions. And if both of those pass, an in-principle acceptance is made, and then as long as you do the thing you said you're going to do, you're effectively accepted. So kind of like, it's like a miniature pre-commitment device that falls within this sort of kind of standard peer review structure. So in theory, this is going to do a few things. So one of them is that it decreases uncertainty, right? So if you're an author, you don't know whether this test is going to get you published or not. You don't know if this is going to take 8 rounds of review. You have no idea, right? It's a huge amount of uncertainty. The uncertainty sort of breeds anxiety about a lot of things. So the uncertainty is important by itself, but also the uncertainty exacerbates some of these other p-hacking type pressures and questionable research practices and publication biases and all that. It's almost certainly going to change publication timelines, but we don't really know if it increases it or decreases it. It probably decreases it. We'll talk a little bit about that later, but we don't know. This kind of adds a little bit of a half step at the beginning of a review process, but it probably prevents multiple rounds of review and that kind of thing. So probably on average, it's going to reduce it, but we don't know because it's never been done before. We think it's going to help reduce publication related biases and questionable research practices, and sort of do those things, focus on the quality of the plan for what you're going to do rather than the results of that, because the results are entirely a result of the quality of the plan or the quality of the methods. So we think it's going to have some impact on these sort of research outcome related outcomes. But to do that, we have to do something a little bit strange because it's really, really hard to do this. And if we think about evidence for a moment, we're thinking about a circular logic for actually doing this. Like, we don't know anything about this particular policy because there's no evidence about this particular policy, right? This is true for any policy in publication in journal reform. And there's no evidence for this because nobody's actually tried the policy. And there's no policy because nobody's, we have no evidence for it, and so on. We get in this really big circle. So we should do some, we should try to do some experimentation, but experiments are incredibly hard to do, particularly in journal reform and journal policy, particularly things like this. There are some other examples here, but for the most part, this is a much bigger change to the workflows and so on than most of those other those experiments. So this is a pretty big one. And there's all kinds of things that make this really hard, and harder than a normal, like a clinical trial or something along those lines. You need a large number of journals to sign on. You need giant, you need a lot of really, really close coordination at the same time happening. And that's hard for journals to do collectively, right? Everybody needs to launch the same thing at the same time and do do things kind of all together on whatever schedule is set. That's basically impossible. There's really no reason to do it, so there's no incentive. So you're going to be whatever. That's a ton of work, and you're not going to really get anything for this as a journal editor, an incredibly busy person. To be, exith author on a publication, that's a bit of a problem. There are all kinds of logistical problems, and there have been a few attempts at this, and they stalled for all of these reasons. So we got to do something totally different. And the way that we're going to do something different is that we're going to erase everything we know about what a trial is and what a study is, and we're going to start at the end. So the ideal situation for knowing something about a policy like this is a meta-analysis of many, many, many trials, right? If a whole lot of journals were to have implemented this policy, preferably in a randomized trial or something along those lines, then we could gather all that evidence together and we could say, okay, here's a more generalizable, more realistic and comprehensive approach to this, right? The journals are going to sort of be able to implement this on their own time and be able to implement it in their own way. So it's a much more realistic policy impact. And then we get all that nice evidence in the end. But here's a problem. How do we actually make those studies? If we just leave this open to the world, we'll get 0 studies. So we have to do something else. We have to actually make those studies. And since we're going to be making those studies, we can do a whole lot of interesting stuff with that. So if we make this a semi-centralized meta-analysis, and we do this backwards, we start with the idea of the meta-analysis and then build the studies based on what the meta-analysis needs, then we get a lot of benefit out of that. So we get all of that shared experience, shared design, all of the sort of, all of the good stuff that we'd really want by all kind of doing the same related things all at once. And that gives us a much better set of, much stronger evidence, much more realistic rollout, and so on. And the idea here is a very strange one. So we are doing kind of what we're calling a semi-centralized meta design, which is that we have at the core of all of this what we're calling a study in a kit. So this is we have basically a box of here's all the parts to this trial. Here is the data collection infrastructure, right? We have this whole online-based system that's really interesting, right? We have the design. We even have code for your analysis that's good to go. We even have an IRB pathway, so you don't have to actually, in most cases, you won't actually have to submit an IRB application. You're part of an existing IRB application, so you just kind of need to be onboarded on to that. a ton of support, right? A ton of design support as well. So we have a centralized protocol or a semi-centralized protocol that we're calling our if anybody remembers Goosebumps when they were a kid, right? That choose your own adventure approach to the story. This is a choose your own adventure protocol. We have options that says like option A, you go here, and move on through this. And that is all pre-approved by an IRB, although that will be modified for sure. And then on top of the study in a kit, when we say it's a kit, it is a kit. That means it's not ours. The kit is open information. It is available for everybody who, conditional on a couple of things. All of that collaboration and so on is, we have ways of sort of communicating and getting people onboarded and so on, but it's not ours. It's the journal's. So that means the journals fully own the data, fully own the publications, fully own the design of some within limits, the particulars of the design, and can also add whatever on. So we have one journal that's likely going to be joining us in the near future. That is actually if they join, they're going to sort of do this trial, but they're also going to take the opportunity to do a totally different randomized policy experiment on top of that, using the infrastructure that we have built here, right? So there's, you can sort of tweak this to your heart's content in a lot of ways, and more, as long as there are sort of certain things that are compatible, we're good to go. And most importantly, they're not our publications, right? So if you run one of these trials, you get first author or whatever authorith publication out of your data, full credit for doing all the work, and can publish it in whatever way you want. And on top of that, anything that comes out of there, so for the meta-analysis that comes later, they're also a co-author on that. For a study in a kit that is, it's not no work by any means, it's a fairly substantial amount of work, but a lot of that work is sort of preloaded, right? So it's a pretty good deal, we think, in terms of academic incentives. Different deal for different people, but you can see sort of ways that this could be valuable. And the way that this is going to work on an individual level, so individual meaning journal, so that what each journal is going to do, this is basically, more or less a two-arm kind of trial, right? It's not very exciting in terms of design, at least in that respect. So people are randomized to the standard review pathway or the registered revision pathway. There's a couple of interesting aspects of this. A couple of things work backwards the way that you normally would do a trial. So in a normal trial, you would screen people and then ask for informed consent. We're doing that the opposite way in here. We want authors to pre-consent into being in the trial, and if in the case that a peer reviewer asks for these new data analysis or new data collection or new analysis of existing data, then they're fully enrolled. There are some interesting logistical reasons for why that basically has to be done in this case. But that pre-consent idea is really interesting for all sorts of reasons. It opens up opportunities for other experiments that are, as part of the manuscript submission process and so on. So there are a lot of interesting logistical problems that we had to solve. So the two trial arms are the standard procedures and the registered revisions arms. We have lots and lots of workflow diagrams. This is sort of a simplified one that just shows, how this kind of cycle works in registered revisions. At the point at which somebody asks for additional data, the authors are asked to write a revision plan. The editors and/or reviewers review the plan, and you get this in principle acceptance. Excuse me. And then the follow-up here is basically based on editorial events and milestones plus some additional survey data. I'm going to pause for a second. Does anybody have any questions, clarifications, like clarification questions that they would like to add?
No, yeah, please, Mario.
Can I ask one question regarding the ethics?
Yeah.
So in clinical trials, if you're adding a new data collection center, you need to have an updated IRB approval or amended existing one. In this case, it seems that you are allowing teams to be added without the need for the same thing.
It's very tricky. That's a great question. I should tell you that solving the problem of the IRB, of how to do IRB approvals for this, took, I can't even tell you how long, right? This has been a huge thing, right? It's very, very complicated. And you're right to compare this to a, a multi-center clinical trial. This is a little, so the way that we are, the way that we are arranging this is we have an approval from the University of Virginia IRB that has this whole study, this kind of choose your own adventure protocol. So many options within that covers individual trial designs following a fairly wide array of choices that fall within our protocol. The way that a journal would get added to this, so the UVA IRB itself has approved this. It's actually an exemption because it's a low risk. But the way that is approved is basically they have agreed to say, okay, if a journal can sort of sign on to this, and as long as they fall within these rubrics, they are accepted within this, so they can participate in this trial. So the only thing that's left is personal requirements from an institutional from your own institution. So if I was, if I was a journal, I would say, my personal, I'm not part of a university anymore, but if I was part of Stanford, I would say, my contract with Stanford says that I have to get an approval with Stanford. Most of the time that can be done with a reliance agreement that just says Stanford agrees to defer to the UVA, University of Virginia IRB, and then everybody's good to go, right? And then as in a clinical trial, it's not necessarily the case that every single person that's involved with the trial, you can think about this like trial staff, needs to be directly on the IRB. It's sort of implementation from there. There are some cases where that's not possible, and in those cases we do a modification to add the, it might be whoever's in charge of the trial at an individual journal to actually be an investigator on the larger trial. So in that case, we do a modification. It's a little bit tricky. Nobody's really done anything quite like this. Nobody's done sort of this is not really one study, it's many studies, but at the same time, it's kind of one study. It's a real gray area, and navigating that has been we'll say a lot of fun. We'll put fun in quotes, maybe. But yeah, you're asking exactly the right questions. I would love to say that there's a definitive answer to this. We think we have a solution, but we're not 100% sure yet.
No, can I ask a very generic question? The trial pertains only to situations where new data or analysis are requested. Is that correct? I mean, because
this trial, yes.
Depending on the type of research and scholarship, if it's like a history journal or many theory journals probably would have no data and no analysis, but even medicine, many of the reviews would ask for nothing new in terms of data and analysis. It would focus more on conceptual issues, limitations, extrapolations, future work, and aesthetics. Unfortunately, which is not really improving the paper much. But so it's a subset.
Yep.
Who is deciding on this is like a good candidate that we do ask for new data and analysis? Is it like the editors who click the button that this is a trial that we can ask the investigators whether they want to try this?
Yeah, that's a great question. So there are a variety of ways of doing this. So again, we have that sort of choose your own adventure style. So we have some flexibility built in for how the journal itself would implement this. Actually, to back up a little bit, different fields and different journals within different fields have very different, amounts of this sort of request, right? So if you're thinking about maybe a less empirically based, I don't know, I'm gonna pick a field, right? A sociology or something journal, right? That will probably have relatively few requests, but if you're in sort of a biology journal, that'll have, you're talking about like 90% of journals that come in will have this. And the person that decides in most cases is going to be either the handling editor themselves, so the editor assigned to that particular manuscript and that particular submission, or an intermediary. So a lot of journals have this sort of two-stage structure. Not all journals, in fact, I think relative depends on the field, where there's a handling editor that makes the decisions, and then it gets passed on to sort of a senior editorial board who, for the most part, does some quality check and rubber stamps it. But there could be somebody in between there, or somebody at the senior level who does this second check for looking for new data requests during that process. So generally speaking, it's going to be someone involved in the editorial process, and usually it's going to be the handling editor themselves. If we have a little bit of time, I can actually show some of the logistics for how that works, but we have a whole workflow worked out for, step by step, here's what to do at each stage and prompts and so on. Did that answer your question?
Intuitively, I think it has to be someone who has the power to make the final decision, because, if you have an intermediary who says, oh, that's a good candidate, and, then there's a commitment, but then the commitment cannot be respected, it's not going to work. Someone will say, well, that editor told me that you will take my paper and I did everything, but no, that was not really the real editor. That was just intermediary.
Oh, sorry. Yeah. Yes, I understand that. Yeah, sorry, I think I misunderstood slightly. Yes, the person making in-principle acceptance decisions will absolutely be a combination of the editor, the handling editor themselves, and probably the senior, if there's a two-level kind of thing, the senior editor themselves. So this is absolutely going to be editorial decisions in that process. It's not going to be, there can be other people that sort of run some of the procedures and logistics and so on, but the editor themselves is going to have to make those decisions for sure. Yeah, it's a good question. All right.
Well, we have one comment from Daniel, who said selection of journal often depends on clinical impact of findings of RCTs in oncology studies. So one may select higher impact journals based on results. So what's your take on that? And are you targeting also higher impact journals with that approach?
Yeah, so that's true, right? So that's part of the, we talk about accept or not accept as publication biases. Often that selection of higher impact journals and so on, that is also part of the problem we're sort of, trying to deal with in some sense. And yeah, so I can't talk about all of the journals that are in the pipeline right now. Not all of them have made public their plans and so on. But yes, there will be some high impact journals involved in this process, right? Also, I generally don't like to, I truly don't want to say that higher impact means better by any means here. But there is definitely a selection process. We should see this at a variety of reputed prominence levels among journals in the near future. Can't talk about all the journals though, but yes, we will.
I mean, I see this as a problem for a big group running a clinical oncology trial. If the results turn out to show no significant effect, it should still get published, but it should not, in my mind, get priority over a study that shows a huge clinical impact, and you want to get this information out to the oncology community as rapidly as possible in a journal that's read by them as much as possible. So it's going to be very difficult for an editor of a major impact journal to guess, is this going to be a study that produces significant results until the study's done. So I see it as a difficulty in a group running a randomized trial to say, well, we're going to make a commitment to which journal, or which journal is going to make a commitment to us without knowing, is the study going to even be close to positive or clinically relevant?
Yeah, so I would actually, I maybe push back about that assumption and say that a null result should be of equal impact if it is a real null result as a significant result. Otherwise, we get incredibly biased literature. But I think that's maybe a conversation that's a little bit outside of the scope of this. But yes, I mean, there are going to be we're going to run into all kinds of culture problems and sort of problems of how people understand and view evidence and how people absorb information and so on. That's kind of part of the larger, I would say, research reform movement. But it might be the case that a higher impact journal would be less interested in something like this because it gives a higher chance that they're going to publish null results, which are viewed as lower quality evidence, which I strongly disagree with. But it will be the case that take-up for this might be, more interesting to people, to journals that are more interested in producing the most, the best strength of evidence above the best sort of impact factor kind of thing. So maybe we'll hold that off a little bit. If we have some extra time, we can talk more about that. Great. All right. So I'm going to move on just to get through a couple more things, and then we can open it up to full discussion. So the data collection for this is actually pretty simple. So most of what we are interested in is already embedded within the editorial system itself. And what we're mostly interested in is actually what happens and when, things that already kind of happened. And we are most interested in collecting things like dates of key editorial decisions, things like, when revisions are submitted, when they're accepted, when they're, when the reviews come back, and so on. So that whole process, the dates of those are actually our main data collection. I'll explain why in a minute. The outcomes of this might not be what what you'd expect. And then collecting some survey data, so things on satisfaction, clarity, and overall experience, and so on. And then post-publication, or maybe not even post-publication, review of the manuscripts themselves for the kind of research, maybe indicators of research quality, where actually we would probably hope to find more, if it's working, then most likely we'll see more results, no more null results from some of these studies, a more sort of truthful representation of the evidence. But that's not the only thing that could happen. There's all kinds of stuff. Talk a bit about that next. So we are really concerned, actually. Those publication outcomes, those research outcomes that we're interested in are, they're sort of one of the primary motivating factors here, but they're actually arguably maybe not the most important factor here. What we're mostly interested in, the most important thing we're interested in for a couple of reasons, both for practical reasons and for really important reasons, is we want to see actually how this impacts timelines. We want to see process outcomes, not necessarily research outcomes. So if this in quotes works, produces better research, but it adds 6 months to the process, then it's a failure. Period. Right? There's no way to interpret that any other way. And so that question of, does this actually increase timelines? Does it change the way that the events, these sort of review rounds are structured, all of that kind of, that process data, we really want to know that. That's actually our primary outcome. And the others, so we're using this, what we call a longitudinal cascade design, because we have an event by event structure for the outcomes. Basically speaking, this is Kaplan-Meier time to event type stuff. So it's time to final decisions, what the final decisions actually are, and all of that. That's our main outcome. There's a second reason for this outcome, which is that that we believe this is actually going to be a much more achievable outcome than a lot of other stuff. You get into really weird territory when you have maybe differential rejection across rejection or even dropout across arms. How do you actually interpret the research outcome side of things for that? If you're talking about more or less p-values, it's on a selected set. There are a couple of causal steps before there. It gets really weird and hard to interpret. So that by itself makes sort of the research outcomes secondary. But there are lots of ways to do that. We can deal with, IV and RCT designs and that kind of thing. But we're in sort of like, we're not as confident we'll actually get to those results here. So primary outcomes are really these time to event, these process outcomes. The journal and author's subjective experience is unbelievably important. Another way that this could fail is let's say that this policy works exactly how we think it's going to do, and everybody loves the results of this policy, but authors and editors hate it. It's a really annoying process, and they just don't want to do it. Policy is a failure, period, right? So we want to know what people think about this and how they experience this. We think that there's going to be this is really outside of most people's experience. So they'll have a tough time sort of onboarding to it, but maybe they like it in the end, or maybe the process can be modified in this in some other ways. That subjective experience is super, super important. And then anything else, and anything else being whatever the journal is interested in. Again, there's this kind of flexible design. So maybe the journal itself is interested in tacking on some other survey or some other experiment. Those outcomes are really important. Now that actually might be a primary outcome for the journal itself, but it's a secondary outcome for us, for the Center for Open Science, that meta-analysis in the end. So the kit design here, I talked a little bit about this. So we did talk, since we sort of went ahead of here, so that choose your own profile or choose your own adventure protocol is pre-written, it's pre-approved, it's very, very flexible. And again, it has that sort of that IRB approval here. So that's that is in a formal partnership with the Center for Open Science, and we can modify that as we need. And again, our journal partners are responsible for personal institutional requirements on their own. And most of the time, that's just going to be a reliance agreement, or at least in the US, that's going to be just a reliance agreement. If things stray sufficiently far, we have to do a whole new IRB, and that's fine also. So we have this data analysis. So we we have a centralized data collection system. So the way we can maybe talk a little bit about details, but people can, the way that editors interact with the data collection is through an external system that's sort of quasi-integrated with the editorial management system. But it's, we collect all of the data. It has very specific formats and everything that we have, we've sort of centralized all of that, which also means that we can do centralized data cleaning. The journal doesn't even need to do the data cleaning. I hate the word cleaning because cleaning, it's not self-evident what cleaner or dirtier data means. It's not like cleaning a house where there's like the shiny thing that's underneath is the goal. Data cleaning is analysis. But we already know the ins and outs of this sort of analysis. And so we can do that for everybody with Common Core analytic code, pre-made visualizations, a whole thing, a dashboard that basically shows you, the main trial results and how to actually interpret these trial results. So we can provide that in prose already. So you don't, you basically have a huge head start on this manuscript that you might write in the end. All that's there. So again, this sort of this shared design idea is really powerful. And then the study in a kit has a ton of workflows. So this is the sort of fancier version, or a fancier version of the previous one that I showed, that sort of shows some of the nitty gritty, how to actually move through this process in a really detailed way, and in a partially automated way as well. So people can sort of move through this process, interacting with the data collection system that tells you what to do next, what to wait for, and so on. The workflows itself are an interesting thing because we're not entirely sure if we're sure that they're not ideal. We're not sure how close we are to ideal yet. So I mentioned briefly that this is all handled in an external system. So this is mostly handled in a web app based system for how we actually collect all of the data and monitor participants and be able to say what is done sort of from an external system. And the reason being that trying to do this within editorial software trying to do this within one suite of editorial software would be a huge task, and trying to do this within every kind of editorial software, again, we're not just interested in one journal, we're interested in every journal, is basically impossible. Now we can integrate things more as we go along, but our external system is designed to make things easier. So we have, right now, this is in Google Forms. It will be in something else in the future, but informed consent, logging all of the events and so on, that's all in our centralized system. And actually this is an older version. There's a new system that's app-based that's much nicer to use. That's all largely automated. So when an informed consent, we have a way of soliciting informed consent that automatically generates emails to send to participants, or potential participants. We have ways of doing all of these things. That's basically click button, which is really handy. And when somebody has an informed consent and the editors have found eligible comments, that automatically generates a block randomization for that individual. So it's a blocked design, and so on. And this is really all designed to make it unbelievably easy as possible, so that the in quotes right way to do it, or the way that we think is right, is the easiest way to do it. You'd actually have to try pretty hard to get outside of that. That is the big task of right now. So right now we are in so this says pilot. We're not even in the true pilot phase. We're in, what we might consider a pre-pilot phase, or a pathfinding pilot phase. A lot of what we're doing here is being invented for this project, right? We have not, doing a randomized trial of a pretty intense journal policy has not really been done very much before, so we have to figure out how to actually do that. Not only we have to do that with one journal, we have to do that with that in a way that's compatible with every journal. So we actually have to generalize quite a bit from the beginning. This meta design is really wild. Designing these workflows, I mean, all this stuff we're having to do kind of from scratch. And so we're not going to do a normal pilot. First, we're going to do a pathfinding pilot, which means basically logistics. We are working through all of these workflows and working through all of these data collection systems and working through designing all of these sorts of things with a group of our Pathfinder pilot partners. There's way too many P's in that. That are helping us co-design things as we go, and most importantly are helping us actually implement things as we go. So we are learning by failing, by actually doing, rather than sort of trying to over-design this here. So the main deliverables, hopefully when we're done with this, was we'll have a full kit of everything that we're happy to sort of give to the wider world. All of that experience and all of those people that worked on that are really the key people who know how to actually do this, and those people are kind of ambassadors for the future parts of this. So what I've shown you here is a policy. It's a registered revisions. That this prospective backward meta-analysis, this is all such weird jargon because we don't know how to talk about this yet. We're learning how to talk about this in the actual within study design, and we think that this is actually going to do something new. We think that this is going to, if it works, and it may not, is going to provide a true way forward for actually doing these sort of large-scale collective evidence projects within our existing system. And we hope that this is actually going to kickstart a whole lot of other interesting experiments and interesting reforms within publication. And quite honestly, beyond publication. These methods are applicable for policy in general. That could be even like government policy and those kinds of things. So this has a potentially really wide scope if it works, or really interesting data if it doesn't work. And we want to be able to document that and tell people about what doesn't work. And we think that's just as important as what does. So right now we're in the sort of the Pathfinder pilot. We have a couple of journals. That's a little bit inaccurate at the moment, what our current Pathfinder journals are. But we have two launches right now. So Leadership Quarterly and Evidence-Based Toxicology have currently launched their pilots as of a couple of weeks ago. So we are just about to start collecting participants, which is super exciting. We're going to be expanding into all kinds of other journals and other areas in the near future. Really excited about this, and I will stop here and ask for questions and comments.